Hello friends, I am Dr. Nikhil Joshi. I am a consultant spine surgeon practicing in Thane. Today I am going to talk about most common problem with which patients come to me, that is slip disc or prolapse intervertebral disc. What is a slip disc? Slip disc means the disc between the two bones, means our spine has got vertebral bodies and in between vertebral bodies we have disc. This disc is made up of two parts. First is the outer cover, which is called as annulus, and the inner structure, which is soft and semi-solid, called as nucleus pulposus. When there is any injury to the outer cover, that leads to intense back pain, and patients are usually locked in that position, and that is very much painful, especially while turning in bed. If that injury persists, then with pressure, nucleus pulposus tries to come out of the rent of the outer cover, and that usually causes compression of the nerve, and that leads to pain and tingling and numbness along the area of distribution of that nerve. That is called as sciatica. Let me clarify here about one thing. Sciatica is a symptom and slip disc is a diagnosis. Many of these patients get confused between slip disc and sciatica. So, sciatica means the symptom of pain, tingling, numbness, and occasionally weakness along the area of the distribution of the nerve which is compressed in the spine. Now, this can be because of many reasons, commonest of which is a slip disc or prolapsed intervertebral disc. The other causes of same being tumors of the spine, infections, or fractures where the nerve is under compression that may mimic the picture of a slip disc, but not necessarily it is slip disc all time. What causes slip disc? Now, most of the times it is the genetics of the patient which is more important. That is the structure of the disc which is weaker in few patients, and that leads to more propensity of developing slip disc. Other factors like excess weight, lifting of heavy weight, especially deadlifts, if it is not observed carefully, then fall or injury directly onto your back, or travel on a bumpy road, or excess weight of himself or herself, that these are the contributing factors but not the causative factors. Most important cause is the genetics, and all these are additive factors. Almost 80% of these patients of slip disc, they do not require surgery. Most of them, they do get better with conservative treatment, which involves rest for optimum period of time, followed by medications to take care of the pain, and physiotherapy and exercises. Those who don't get better with routine conservative treatment, they are the ones which may require surgery, and also those who come with a profound deficit like weakness or loss of bladder and bowel control. That means they cannot control passing urinary motion. That is the condition where we have to do surgery under emergency circumstances. In surgical treatment of slip disc or prolapsed vertebral disc, there are multiple options available nowadays, which involves open surgery, that is microdiscectomy, or keyhole surgery, or a minimally invasive spine surgery, or there is something called as endoscopic spine surgery as well. The advantages of these surgeries include less blood loss, small cut on the skin. At the same time, the post-operative pain is also less. That leads to early recovery from the surgery, and the patient can be mobilized as early as possible after surgery. These surgeries are safe, and the rate of complications with new technology and a good armamentarium at hand are very less, and they are very safe in today's world. Now, there is something called as a nerve root injection or a epidural steroid injection, which is also practiced as a midway between surgery and conservative treatment, where we inject around the nerve which is compressed with a steroid and local anesthetic medication. That way, we numb the nerve so that the patient's pain is under control, and the person in question can do physiotherapy and exercises. Most important for the slip disc is prevention than treatment. So, to prevent this, we need to have a proper posture while sitting, standing, walking, as well as while sleeping, because almost 7 to 8 hours we are spending that much time in our sleep. So, proper posture during sleep is also important, especially with work from home. The question of abnormal posture is arising very fast, So we have to have a good posture while working. Especially, you should have a good ergonomic chair while working on your laptop or workstations. Regular exercise, swimming, regular walking are also beneficial factors, and one should have an active lifestyle and avoid having excess weight. Thank you very much.